Good morning, Aber.
Good morning.
Yes, you are welcome to this discussion. We are going to be talking about the global health, and it's a very important topic that people would like to know more about it. So the first question is, global health seems to be in the news more and more in recent years. So talk about what global health is and why it's important to pay attention to it.
As the name itself suggests, global health is the health of all individuals living in the world. So, global health deals with how illnesses are fought and how they are prevented in the mirror of the world in general. So, if uh, there is a threat in this country, uh, and it can affect the rest of the countries in the world, that is an issue of global health. So the health is seen in the mirror of the whole world instead of seeing the threat as an issue for one country or another. So it is important because it helps in avoiding new contamination, transferring some diseases from one country to another.
Okay. So disease can come to us in different ways. Explain the difference between communicable and non-communicable disease.
The communicable diseases are those diseases which can be spread from one person to another. Let's take an example. Common cold, that is Ebola, cholera, HIV, AIDS. So those are all diseases which can be spread from this person to another. On the other side, non-communicable diseases are those diseases which cannot be spread from one person to another. Let's just take an example. There are some kinds of allergies. There's also two, uh, type 2 diabetes and sickle cell diseases. Yeah.
Okay. Let's talk about Ebola. Since I am sure most of our viewers have heard a lot of about it, what is it? Is it communicable or non-communicable? How do people get it?
Thank you for the good question. Actually, Ebola is a very dangerous threat which is found in Africa, mainly West Africa, and it is caused by infection with one of the Ebola virus species. So the Ebola was found in Africa in 1976, and people can get Ebola through contact with those people, just blood and body fluids of a person who is sick or who has died from Ebola. Also, the contact with objects that have been contaminated with body fluids from a person who is sick or who has died of the infection.
Well, what would rise a person's risk of getting Ebola? So to prevent or at least lessen the chance of getting Ebola, what should the people do?
Uh, in some cases, you see, when a person is suffering from Ebola, uh, when the person does not reach the hospital as soon as possible, there are more risks of transferring or contaminating others because this disease is spread very easily just by having contact with a person fluids or blood, and the person suffers from the threat. So, how can people avoid it? The best way of avoiding new contamination is communicating the Ebola cases to people in charge, those healthcare professionals, so that the people who are suffering uh, can get some help, and that of course helps in stopping some contaminations. since people are going to be free from such infections. That would help that can help a person who is suffering getting the medical assistance while preventing new contamination.
Great. Outbreaks such as the one related to Ebola can generate a lot of rumors and misinformation, and even panic about what the disease is. How is it transmitted, and how likely people are to get it? Talk about the need for educating people about facts versus myths.
Yeah, thank you for the good question. Actually, since people know that Ebola is very dangerous and it is easily spread, some people have developed some myths and which are not actually factual. Since people have got to know how dangerous is Ebola is, it has led to a high level of discrimination of those who are suffering from the virus. People have developed myths such as the following. Ebola can be caused by a mosquito. This is not really yeah. Another myth is that you can get Ebola through drinking water. You can get Ebola by just touching someone, and this is not true. And some people say you can buy effective treatment for Ebola online. This, scams and those fraud makers, they can tell you that we have the medicine for Ebola while they are not. So there is a need of educating people how Ebola looks like, differentiating those myths and factual things.
Okay, great. How about the complications that Ebola raises for the rights of travelers and the responsibilities of governments? Cassie Hickox, for example, a nurse from Mainz who returned to the States following a trip to West Africa in the fall of 2014, promptly had quarantine-related restrictions thrust upon her, restrictions that she was very much against.
Okay. It is true that when someone is going to go in those West African countries, some people say you are going to bring the Ebola, what? And when you are from those countries, you seem to be isolated from other people. So you see, Kachi Hickox is an example of how countries are afraid of Ebola. When a person has been in Africa sometimes, he or she can sometimes passes some he can sometimes pass some health test to prove his or her life condition. You see, when this person reached America, he passed several tests to make sure that she is free from such things. So this is not actually good because the government, of course, the government was trying to protect its people, but on the other hand, the person had right to be free from the isolation. So sometimes government responsibilities conflict with individuals' rights.
Great. Briefly describe the difficulty of balancing individual rights and governmental responsibility.
That's just what I was saying. Governments may want to protect its people from new contaminations such as Ebola. When Ebola has reached a country, it's a very serious threat. But on the other hand, the person has rights to move freely and just be free from such isolations. So those are two things which conflict with each other.
Okay. Let's talk about smoking and tobacco use. which is considered a big world health problem and raises similar issues to Ebola in terms of rights and responsibilities.
Yeah.
Just about everyone knows that smoking harms health. What does it do to the body?
Of course, smoking is not good at all because it causes many health problems. We can look at the following examples. Smoking causes cancer. That's obvious. Also heart diseases, strokes, lung diseases, diabetes, and chronic pulmonary diseases.
Yeah.
So a person may suffer from tobacco effects through second-hand smoking. Sometimes when you live with a person who smokes,
Okay.
you can get some problems from him.
Okay, great. What about Scotland smoke? Explain what that is and how it affects people.
Second-hand smoke is a smoke that has been exhaled or breathed out by another person who is smoking. So the second-hand smoke destroys people as smoking destroys smokers themselves. So it means that if a person is near you and he's smoking, you can suffer from the same effects. Yeah.
Okay, it's second hand. It's second hand smoke. Okay.
Yeah.
I misspelled the word. Okay, thank you for the great answer. Yeah. And the next question is, people don't typically think of tobacco as the drug like heroin or cocaine, but the addiction it creates is strong, isn't it?
Yes.
So do we think of tobacco use as a form of substance abuse?
Personally, I really agree that tobacco is a drug like those cocaine and heroin. That's because its addiction is very dangerous and it destroys. When a person has taken tobacco, he gets addicted very easily and he can just, his or her mind may be deviated in this way or another. So, drugs are those which deviate the minds of people as the tobacco can do, as it is smoked for a long time.
Okay. Actually, those are the questions that I had to ask you, and I hope people will got to know much about the global health topic. And I really thank you for talking to us.
Yeah, thank you.
Okay, great.